2025, more than 4,500 cases of measles have been reported. That is more cases in the year and a half since Donald Trump has been president than were reported from 2000 to 2020.
What was supposed to be a confirmation hearing quickly turned into a blistering indictment of the Trump administration's public health agenda. One Democratic senator accused the White House of fueling vaccine misinformation, gutting scientific research, and trying to entrap a respected public health nominee instead of addressing America's growing health crises. Here's what happened.
Senator Hassan.
Thank you. Dr. Fauci, I want to start by thanking you for more than 50 years of service to this country at the National Institutes of Health. And it is unfortunate that you have been put in the position that you are in today. And it must be enormously frustrating to know that this hearing is designed to entrap you. It must be very frustrating for your attorneys to hear the chair's mischaracterization of the legal issues and posture that impact your decisions at the witness table today. Meanwhile, I was going to ask you a series of questions about things that are relevant right now to the people of the United States about the state of public health in this country. Since President Trump took office in 2025, more than 4,500 cases of measles have been reported. That is more cases in the year and a half since Donald Trump has been president than were reported from 2000 to 2024 combined. Children are dying because there has been increased vaccine hesitancy, fueled by Robert F. Kennedy Jr., the Secretary of Health and Human Services, and frankly, his entire administration. Thousands of people in the United States of America have been sickened by a foodborne parasite, and the outbreak is nowhere near under control, as staffing at the FDA and other critical public health entities has been slashed by Russell Vought and Elon Musk. Last year, the National Institutes of Health awarded 201 fewer grants compared to the previous years. 207, I am corrected, compared to previous years. As those grants were either canceled or delays, especially at the beginning of the Trump administration, I can tell my colleagues what the impact was on people in New Hampshire, on scientists in New Hampshire, on clinical trials in New Hampshire where people's cancer treatment was interrupted because Elon Musk and Russell Vought know better, they say, than the people at NIH about what to fund. And because they did some sort of word search, it seems, for some of the grants, and boy, oh boy, if you were studying rural health in New Hampshire and trying to understand how to better engage people who need health care in rural America, that was off the table. America is losing researchers and scientists to other countries because researchers and scientists, highly trained, highly qualified, invested in often by the American taxpayer, are finding the hostility from this administration so strong that it interferes with their science, and they want to pursue science wherever that science takes them. I also sit on the Health, Education, Labor, and Pensions Committee. We have had a number of hearings with nominees recently to fill critical spots. One of those nominees is Dr. Erica Schwartz, a brilliant woman, medical degree, biomedical engineering degree. I think she also told us she has a law degree and a master's in public health. She was a two-star admiral in the United States Navy, an experienced doctor. And yet, when I asked her if she would push back at Secretary Kennedy if he instructed her to suspend the promotion of the flu vaccine, as he did at some point in the last few months. There's an email to prove it. She couldn't answer that question. She either could not, would not, or had been bullied into evading a question about whether she, as the director of CDC, would stand up to Secretary Kennedy, the most unqualified Secretary of Health and Human Services this country has ever seen, and more than unqualified, somebody who pursues conspiracy theories, degrades people with disabilities, and continues to promote disproved science. That's the state of healthcare and public health in this country right now, not to mention the $1 trillion or so of cuts to the Medicaid program that is decimating healthcare in my state and decimating it around the country, not to mention the refusal of my colleagues and this administration to extend critical tax cuts for people who are trying to afford insurance on the Affordable Care Act. I just was at one of my community health clinics, and they are reporting fewer and fewer people coming in for care, disrupting care because they can no longer afford health insurance. And that is impacting, of course, the revenue stream to the community health clinic, their ability to hire and pay people, their ability to take care of their community. That's what I wish we were having hearings about in this committee and in the Health Committee. That's what I wish we were.
The hearing took a sharp turn when a Democratic senator used her time to criticize what she described as the Trump administration's handling of public health rather than focusing solely on the nominee before the committee. She began by pointing to what she described as a dramatic rise in measles cases since President Trump's return to office, arguing that vaccine hesitancy had increased under the leadership of Health and Human Services Secretary Robert F. Kennedy, Jr. According to the senator, preventable diseases were once again threatening communities because public confidence in vaccines had been undermined. She then expanded her criticism beyond vaccines, highlighting a foodborne parasite outbreak that she argued remained uncontrolled while staffing at the Food and Drug Administration and other federal health agencies had been significantly reduced. She blamed those reductions on decisions made by the administration, arguing that fewer public health professionals meant slower responses to emerging health threats. The senator next turned her attention to medical research, saying National Institutes of Health grants had been delayed or canceled early in the Trump administration. She described how researchers in New Hampshire saw cancer clinical trials interrupted and rural health projects abandoned, arguing that political interference had replaced scientific judgment in determining which research received funding. According to the senator, the consequences stretched far beyond individual grants. She warned that highly trained scientists and researchers were leaving the United States to continue their work elsewhere because they no longer believed scientific research could be conducted free from political pressure. She then referenced a recent confirmation hearing involving Dr. Erica Schwartz, a physician, biomedical engineer, former Navy two-star admiral, and public health expert. The senator praised Schwartz's credentials but expressed concern that she declined to say whether she would challenge Secretary Kennedy if directed to halt the promotion of flu vaccines. For the senator, that exchange symbolized a larger problem. She argued that experienced public health officials were increasingly unwilling to contradict political leadership, even on issues involving established medical science. Her criticism of Secretary Kennedy became even more direct. She described him as the most unqualified Health and Human Services Secretary the country had ever seen, accusing him of promoting conspiracy theories, undermining confidence in vaccines, and embracing claims that had been repeatedly rejected by the scientific community. The senator also criticized the administration's healthcare policies more broadly, arguing that reductions to Medicaid funding and the expiration of Affordable Care Act assistance were making health insurance less affordable. She said community health clinics in her state were already seeing fewer patients because many families could no longer afford coverage, placing additional financial pressure on healthcare providers already struggling to meet demand. As she concluded, the senator argued that Congress should be holding bipartisan hearings focused on improving public health, expanding healthcare access, and supporting scientific research instead of what she characterized as politically motivated attacks on experienced public health professionals. Ending her remarks, she accused committee leaders of using the hearing to entrap a nominee whose career had been dedicated to protecting Americans' health rather than addressing the urgent healthcare challenges facing the country.